Coping with COVID-19, brought to you by Guardian Group. Live easy.
And that's exactly what we've been doing for you for the past few weeks. We've been helping you to cope with COVID-19. And someone who's been with us for quite a bit of time, because she has a lot of information, the expert actually, is Dr. Erica Wheeler, who is the Trinidad and Tobago country representative for PAHO and the WHO, as well as for the Dutch Caribbean Islands. Good morning. Welcome back, Dr. Wheeler.
Good morning.
So come midnight, all non-essential services will be closed, and persons who are working in those areas are asked to stay at home. How concerned should we be at this time?
Well, I can see that the government has been steadily taking measures to protect the population. So I don't feel there's any serious cause for concern. The government has learned from other countries, of course, like the experience in China, the current experience in Italy, and we observe what's happening in the US now.
Yeah.
So there is no cause to be seriously concerned. We do have to take measures because all the evidence shows that social distancing, as well as preventing a high volume of movement, is one of the things that will suppress the spread of the virus. So we have to be sensible and learn from other countries.
And so we are noticing a series of steps. And, you know, persons are making noises out there and saying, you know, close it down, lock it down, shut it down. But the government is following. I remember you had said there's a protocol for all countries, guided by the WHO, who has been preparing countries for years now how to deal with a pandemic.
Yes.
So the government is following guidance, right, from the World Health Organization. Is this what's happening?
Well, yes, there is experience previously from SARS and MERS, although SARS and MERS was not global, but certainly we can learn from previous experiences, and WHO has been compiling information, of course, from those two parts of the world and looking at this new coronavirus and how we then deal with that and apply it to the current situation globally. But every country's context, there are different stages of the outbreak. At one point, we didn't have any cases. Then we had our first case. Then we had second cases and so on. But then there was the introduction of the persons from the cruise ship. So each time the situation changes, the government has to re-examine where we are and adapt locally to address the context. And as we said before, flatten the curve, meaning suppress the spread of the virus, because until now, of course, there is no vaccine. There won't be one for some time to come. We are not sure exactly when. So the sensible thing to do is follow the guidance and take all of the precautionary measures.
So if we remove the persons who came from the cruise, which is a single source, our numbers are not as high as, you know, we're not up there, really.
No, and you're completely correct. And there was the responsibility the government took on to take in the nationals. So therefore, we have to think about that in total, there are probably about 72 or 73 people who were on that cruise. So therefore, when you're on a cruise ship, it's like an incubator. So it is not entirely surprising that many of the persons tested positive for COVID. So if you took those persons away, then the numbers are not alarming. And not that they are alarming now, but we have to take into consideration those cases that were imported from the cruise ship.
Yeah, so we've had a number of imported cases, but as the virus evolves in various countries, the next stage is community spread, which is inevitable at some point, especially as we're seeing people, and now we know for a fact there are people who came back and did not self-quarantine and were mixing with others. So we anticipate some level of community spread. Tell us how that usually evolves.
Yes, well, you're absolutely correct. You've clearly been doing your research, Lisa.
I feel like I'm everything COVID-19, and then of course our interviews are so, you know, insightful.
Thank you. But yes, it is true. Once there are persons who've been exposed and who come back, they don't know if they have it until they start getting symptoms. But in the meanwhile, if you do have it, the chances are that once you come into contact with other persons, they will have the possibility of contracting it as well. The evidence, based on the research from China, shows that for every one person who contracted COVID-19, they can infect at least 3 other people. And then those 3 people, depending on who they're in contact with, they can infect other people. So you can see very quickly why the number of cases climbed in China, in South Korea, in Italy, because it is a highly transmissible disease. We do remind people that although 80% of persons who become infected may not need hospital care, it's an evolving disease, and we have absolutely no immunity to it. So therefore, self-quarantine, 14 days after you return from an area, well, we are not traveling anymore, but for those who recently had traveled and come back, self-quarantine is the responsible thing to do, because you do have the possibility of spreading the virus.
And the fact that we have evidence now that persons did not follow those guidelines and did not self-quarantine, what are the chances of community spread now?
So yes, there are chances. We have to admit it, there are chances of community spread. So the thing to do now is to test,
right,
and do contact tracing of those persons with whom they were in contact. So those individuals who came back, who did not self-quarantine, all of the persons with whom they've been in contact need to be identified, and they need to also self-quarantine. So this is why local community spread it's inevitable, because once you have persons who've had it who did not self-quarantine, then the chances are that they can give it to others.
Let's talk about the testing, because once you increase the sample size of testing, it means that the chances of an increase in positive results will increase, so that it may appear as a spike, but is it a reason to be concerned?
No. In fact, all the guidance says from WHO now that you must identify those persons with whom someone who's been diagnosed as having COVID-19, you must do contact tracing and you must do testing. It is critical to do testing, because it's only when you do testing and you then put people into either isolation or into quarantine, then you can begin to get this pandemic under control. So yes, the numbers will spike. That is inevitable, because as you test, you would find more people. But again, remember, of all of the people who have it, not everyone will end up in hospital. But we have to be able to identify those who have been in contact with someone with it in the community, so that in the long run we flatten that curve, even though we may have cases until we find a vaccine, and it's probably inevitable because we have no immunity. It is critical to keep testing. So the fact that the numbers goes up is normal,
right?
But it is not a cause for concern. It means that the authorities are doing what they are supposed to be doing, which is testing everyone who may be suspected of being in contact with someone who has it. But that is in order to take action. That is the important thing.
Yes.
If you don't identify people, you can't take action.
Yeah.
You can't tell people they must self-quarantine. You can't take measures if the government needs to ensure that that happens. So please, we must accept that testing is necessary, and the numbers will go up in the meantime.
All right, we're going to have to leave it there. I know from next week we're going to be chatting because we are also taking measures here. So from next week, we will continue the conversation via Skype, Zoom, or phone with you, Dr. Erica Wheeler. I want us to talk next week about tracing. How does the contact tracing really take place? So we're going to have you back next week. Next week, Tuesday, I believe, to talk about that.
Thank you again,
right.
Lisa.
Dr. Erica Wheeler, PAHO and WHO country representative for Trinidad and Tobago and the Dutch Caribbean Islands. This has been Coping with COVID.
Coping with COVID-19, brought to you by Guardian Group. Live easy.